The most common question I get after a therapy session and podcast episode is, what books do you recommend? Which I totally get. I just bombarded you with a bunch of information between 30 to 60 minutes. And if you're like me and can't remember everything, and it's just like an information overload, you may want a resource to review, or you maybe just you don't trust me after all the hubbub and you just want a second source. Or maybe it's a form of integration. Makes sense. I'm the same way. Studies show that bibliotherapy, which is a fancy term for therapists recommending books between sessions, works. One meta analysis from 2010 compared face to face therapy with self help books. They examined 24 studies with 810 participants. The results, self help books were slightly more effective than face to face therapy. Now, before you write off therapy and cancel your next appointment with your therapist, please keep in mind that they also found that all the books that were used in these studies were cognitive behavioral and not the average self-help book that you see in the self-improvement section in Barnes& and Noble. These studies also included minimal therapist support, meaning speaking with a therapist individually or briefly in a group therapy while reading the book. They also found that those in self-help book samples were more likely to drop out, although the differences was not significant. Still, this suggests that reading self-help books does help and is among the most common interventions in psychotherapy. One survey found that 85% of therapists recommend bibliotherapy or include it in their practice. My hot take and personal policy is that I don't recommend any books I haven't personally read or vetted. I don't trust self-help books. I observe that many of the commonly read, most popular books, self-help books that you see in the Barnes& and Noble section aren't written by mental health professionals who are held up at the same high ethical standard in publication and treatment. And I'm not wrong. One study in 2008 had a sample of 3,500 mental health professionals vet 700 self-help books that were published between the years 2000 and 2005 that were aimed at treating depression, anxiety, and trauma. In that study, they found that 82% of the authors were in fact practicing mental health providers. However, 18% of these books provided no citations for their claims. As you have already noticed, I average about 12 citations per 30-minute episode on my podcast, which makes me feel like having no citations is problematic. 16% of these self-help books refer to energy therapy, which has no scientific basis. I don't even know what energy therapy is. 18% were judged by mental health providers for being iatrogenic, which means that it refers to another medical issue without having any medical knowledge, and giving supplement and medication advice without a medical degree. That's dangerous. Some even gave Christian evangelical scripture recommendations. Problematic. Mind you, these are books primarily written by psychotherapists for specific issues. This does not account for the current books that are generally based on and written by non-mental health providers, or the current books out right now. While preparing for this episode, most of the studies I've come across are from the early 2000s. It's almost like after 2010, we gave up on studying self-help books, which to me is a red flag. Which makes me think, who holds them accountable? Who checks where what they write is evidence-based, ethical, and effective? Today's episode on whether self-help books are ethical came from a recent observation. In December 2025, a bunch of therapists gave scathing reviews and criticism to the highly acclaimed book, Let Them by Mel Robbins. I'm not going to go into detail about my thoughts on the book. I don't feel the need to. Instead, I will summarize the reactions I observed from my colleagues. This is observational data, so it is biased and completely influenced by my algorithm, which composes of mostly therapists. But what I observed is that the reactions of my colleagues oppose the book in their lens of practice. So, for example, if you're a family therapist, They criticize it in the family therapy lens. If they were a trauma therapist, they criticized it in a trauma-informed lens. The resounding message was, we stay in our lane, so stay in yours. And this makes sense. We therapists have to follow APA, ACA, NASW, or AMFT codes of ethics. What is a code of ethics? These are standards of practice that every mental health provider must follow to maintain good standing with their licensing board and to preserve trust in our profession. I, for example, am an LMHC in Florida, so I follow the ACA Code of Ethics. One of the biggest standards is Section C, number 2, called Professional Competence. This section explains that I must practice therapy within the scope of my education, training, and supervision. So yeah, I'm a sex therapist. I can talk about sex, I can talk about intimacy because I completed extra training and certification to discuss these topics ethically. But you will not hear me talk about medicine, medication, or give any kind of legal advice because that's way beyond my scope. So you're already starting to see my issue with self-help books here and why I might be inclined to agree with my colleagues. If you don't know, Mel Robbins is not a psychotherapist or a psychologist. She has zero formal training in psychology or mental health. I don't know how accurate celebrity net worth sites are, but according to booksx.com and capitalbeacons.com, it sounds sketchy websites, but I think every celebrity net worth site is. But they estimate her net worth to be between 15 and 20 million. Again, I don't want to focus this episode on her book or her career. Rather, I want to focus on self-help books in general, which is quite fascinating. The market for self-help books is estimated to be between 14.2 billion in 2025, according to Alibaba. And seeing that self-help books are very profitable and are projected to be part of a $72 billion industry in 2030. It makes you wonder whether they're really in our best interests or if the industry is prioritizing profit over giving appropriate care to our mental health. Today's episode, I'm introducing Dr. Daniel Water, who received his doctoral degree from New York University in 1985 and has also earned a postgraduate certificate in medical humanities with a concentration in medical ethics from Drew University in Madison, New Jersey. He is licensed as both a psychologist and a marital and family therapist. Dr. Water is an ASEC certified sex therapy supervisor and has been elected to fellowship status in the International Society for the Study of Women's Sexual Health, ISWSH, and the Sexual Medicine Society of North America. He's a frequent lecturer at professional meetings throughout North America. Dr. Water is an author of more than 30 peer-reviewed articles and book chapters on topics such as sexual functioning and dysfunction and ethics in healthcare practice. He is the author of the recent released books, The Existential Importance of the Penis, A Guide to Understanding Male Sexuality. I'm like, here's the book. I got it. I bought it. I read it. And I also took the class on it. So you can see why I'm excited to invite him to today's episode where we're going to discuss whether there are appropriate safeguards in place for a rapid growing industry and how we can create a reliable library of bibliotherapy as therapists and readers. Welcome to Things I Meant to Say Naked, a podcast about mental health, desire, intimacy, and the truths that we carry in our bodies. I'm Figs, a certified sex therapist, a licensed mental health counselor, a lover, and someone who has spent way too much time overthinking and turned that into her career. This show is part education, part commentary, and part love letter to the versions of us that don't know what the hell we're doing, but want to feel really good doing it. Some episodes will be just me, offering insights, stories, and spicy takes on the erotic. Others will feature guests, lovers, and maybe a little bit of chaos. So get comfy, and let's get into things that we were meant to say naked. Although this podcast explores themes of mental health, relationships, and sexuality, it's for educational and entertainment purposes only, and is not a substitute for professional mental health care. If you find yourself struggling, please reach out to a licensed provider in your area. Thank you, Dr. Water, for joining me in today's episode. I really, really appreciate you.
It's my pleasure.
So, let me address my first concern while preparing for today's topic. Most of the articles that I've read and researched in the field of self help books are in the early 2000s. And it was actually really difficult for me to find anything that was recent. And it may be because right now, a research interest is going into AI's impact on mental health in terms of outside the traditional mental health treatment. So we don't really have any recent findings to go by. And given that most of the research on self help books is outdated, how ethical is it for this rapidly growing industry to continue positioning itself as psychologically beneficial without a strong current empirical support?
Hmm. It's an interesting question. And I'm not really that familiar with any studies that have really looked at the impact of self-help books. And I think it would be hard research to do because, you know, uh, self-help books are written for a broad group of people. And, therapy is usually about one person, or one couple or one family, for
Uh-huh.
example. And the way I was always trained was that every person, it's an individual therapy for that person. Everybody gets their own therapy that's tailored specifically to them and what their concerns are. And so, self-help books, they can be very useful. They can be very helpful. They may help people in some general way, but to me, they're more of an introduction to get people started in the therapy process. To think that they are in and of themselves a type of therapy, to me is problematic. And so when I think about the ethics of self-help books, the fact that we don't have a lot of outcome data, um, doesn't really bother me as much as you might think, because the
That's an
outcome
interesting
data on
take.
psychotherapy is very difficult, to assess, and we don't really have data that says what type of therapy works best for what type of person. We don't really have data that suggests, that therapy gains are maintained 3 months, 6 months, a year, 5 years later. There's a lot that we don't know. And there's also a lot that, frankly, I think we can't measure. I don't know that therapy outcomes are so easily measurable, no matter what kind of research we do. I'm sort of a proponent, of the idea, that which is relevant is not measurable, and that which is measurable is not relevant. So,
Okay.
from the ethics part of it, I'm more concerned about why people write self-help books. To me, if their desire is to do good, to be helpful to people, to encourage them to pursue deeper introspection and reflection, I'm good with that. If their goal is to just make money, to try and put something out there that really is of questionable value, that really even anecdotal evidence behind it that this is useful or this is helpful, and it's really just kind of a money grab. That's where I
Mm.
really have more problems with the ethics of self help books.
See, that's where it's a little bit complicated because as a therapist, we do get paid. We do make money off of, quite frankly, helping others.
Hmm.
And I think all of us, in some regard, motivation to write a self help book is to monetize off of it. And so, at what point does monetization or, just enjoying the fruits of your labor become unethical versus ethical? And it's also interesting to hear you say that it not being measurable in terms of whether a certain treatment is effective or not, because I think in the field of psychotherapy, we talk so much about evidence based treatment.
Hmm.
And we love throwing that word around. And usually that suggests that it has been researched, it has been studied. And now you're making me think, or kind of questioning like, well, what really makes it evidence based?
Yeah.
Are we are in the same field or playground as self-help books that has little to no guidance?
I think a lot of therapists would certainly disagree with me and disagree with me strongly.
Okay.
But, I don't put much stock in the term evidence-based. I don't really
Interesting.
know what that means. I don't really know, how that comes to be assessed. And I think the point that is often missed, is that, psychotherapy is as much, if not more so, an art, than it is science. We are helping
Completely
people
agree.
with problems of living. And those are not always so easy to concretize. And certainly change is not easy to measure, except in some very basic, very obvious ways. I think we forget sometimes that non validated is not the same as invalidated. Just because there's no quote unquote research to support it doesn't mean that we don't know that the process is helpful, because we certainly do.
I'm so conflicted about this because I often feel like I have to prove myself or kind of prove to others that the field of psychology is a science.
Mhm.
And, we always talk about validity and reliability and being measurable. And for a long time, therapy and psychology has been considered like a pseudoscience, kind of
Mhm.
woo woo. And hearing you
Yes.
speak, you're like, well, you know what? We might have to put some weight on the woo woo. Maybe,
Well,
maybe non traditional therapy it might be effective.
well, you know what? I don't think it's woo-woo to those people who come into therapy because they are truly suffering and looking to find some relief or some meaning in their lives or live their lives better. The
Hmm.
data that I have seen, even though it doesn't, say necessarily a lot about the specifics, but shows that overwhelmingly people who come into psychotherapy benefit from psychotherapy. They believe they have benefited from psychotherapy. Whether or not what they came in for has actually changed, because sometimes it doesn't, sometimes what we're working on is helping people deal with what is not changeable. And sometimes we're
Mm-hmm.
dealing with helping people accept the uncertainties of life, the vagaries of life, the maladies of life. Everything can't be fixed, but we can learn to deal with things in a better way so that we can continue to have good, meaningful, fulfilling lives.
Yeah. And how many times have we seen clients where they come in for one issue and we treat a whole different one? Or what they find or deem important, maybe we are feel like we should focus our attention on another thing.
Yes.
And it's truly to me, it's almost like a dance. Like, I love how each person I work with in the counseling room, it's a different dynamic, it's a different sense of humor, it's a different vocabulary, it's a different tone. And I think that's just where you're pretty much saying it's an art. It's an art of conversation that, yes, it requires, in my case, 2 master's degrees to be
Hmm.
talented in this art.
Yes.
But, I think that's really hard for a lot of people to understand, and I will be really curious to hear what listeners will think after hearing you say that, well, we might not be able to fix everything.
No. Well, I would take it even a step further. We are not able to fix everything. There are many things that cannot be fixed. They can be accommodated for, they can be dealt with, they can be worked with, they can be accepted, right? But for example, if we're dealing with someone about the ending of a relationship or the death of someone or their own diagnosis of a terminal illness, we can't fix that,
No.
but we can help people through it. We can we can walk through it with them and provide a great deal of comfort and healing of distress.
I think that's very beautiful. I like to think of myself and as kinda like a passenger in terms
Mhm.
of being there for my clients and watching them experience life and hardships, successes, and new chapters in their life, and I just get to be part of it and see them overcome it. I think one of the things I say as a therapist all the time, I think I have the best job in the world because 'cause I'm collecting wisdom or many lifetimes. I'm living it vicariously through others,
Yeah,
and
yeah.
it's such a joy.
It
I
is.
agree wholeheartedly.
It is. It's a wonderful profession. It's a true privilege to be let into people's lives in the way that we are. People, they tell us things, they confide things in us that they never tell anyone else, which is why the
Mhm,
therapeutic relationship is really the biggest tool in the toolbox of an effective psychotherapist. The ability to create a good, supportive,
mhm.
therapeutic relationship is the art. That's the real art.
Yeah. And that's just something that self-help books just can't accomplish. Like,
No.
there might be some amazing information on there, maybe a great story that can resonate for many,
Hmm.
but can a book cater? Can it be specific to an individual? Can it listen and can it respond and can it follow up?
No, of course not. And so, self-help books, even under the best of circumstances, they have their limitations. But the
Right.
idea that a self-help book can in and of itself be therapy, to me is kind of similar to the whole idea of, evidence-based therapy, that therapy can be, so easily measured. To me, both ideas are reductionistic. They
Mm,
assume that people are much less complicated than they are. They assume that people are one-dimensional, and
mm.
they're much more than that.
I wholeheartedly agree, and I just that's also, like, the fun part of, like, therapy is that throughout a therapeutic process, when I feel like I have unpeeled the layers of an onion, like, there is a whole new onion that's appearing, and then or oftentimes, I don't know if this happens to you, I terminate therapy, or I like to say we graduate, and it's amazing, and I'm like,
Mhm.
"Woo, amazing." And years later, months later, they come back and they're like, "Well, so I went on a hike and I thought really hard about what you said this one time that I completely forgot about and I had to go and review my notes about." And they're like, and then it brought back a lot of feelings and a lot of
Mhm.
things I want to talk about. And it's always a joy to invite them back.
Absolutely. The idea that therapy has a concrete endpoint. To me, I always say to people that I work with when they express that they feel like, it's time for a break or they're good or they
Yeah.
got what they wanted. I always say, well, the door is always open.
Hmm.
If for any reason you need to pick up the phone and call again, I'm always happy to hear from
You're much nicer than I am.
you. Oh,
So, so when my clients, when we're done with therapy, maybe because I'm a very Colombian therapist, and we have sometimes this sense of humor that you'll hear it. So when my clients are done with therapy, a lot of times I say, "I hope I never see you again," and they start cracking up, and I'm like, "But if I do, I am more than happy to welcome you back, and I'm excited to work with you again."
yeah,
And so they
yeah.
always leave, laughing and being like, "Oh, yeah, I hope I never see you again." I'm like, "Yeah, same."
And of course, I mean, look, it's funny, but it's a good sentiment, right? I hope you don't suffer anymore, right? I
Exactly.
hope you don't find yourself in a position where you're in, great pain again. So,
Yeah.
you know,
They don't seek me out because good things are happening, you know? So
yes, yes, that is true. And I've had many, many people call me a year later, 5 years later. 10
Mhm.
years later, I got a call from someone, a few weeks ago who I had seen almost 30 years ago.
Wow. How was that like?
Yeah, and they said, "You helped me so much then, but I have a different situation that I need to talk about, and so I thought of you."
Oh, wow, I mean, what a blessing that is, right? To
It's
be
wonderful.
the first person that person thinks of when they're going through
Well,
some hardship.
yes, I think, that we forget sometimes, even those of us who are therapists, we forget sometimes that we play a very important part in people's lives, and we have a very important role in their lives. And, if we do our job right, people become very attached to us and us to them.
Mhm.
I mean, obviously, we do that in a professional way,
Mhm.
but most of the therapists that I know of, and certainly for myself, I, am very concerned about the well-being of the people that I work with. I genuinely care about them.
I do check in. There's no way I can leave this unscathed.
Yeah, no one leaves this world unscathed. Yes.
There's no way
So,
I can have
mm,
any therapeutic relationship without having part of them in my life as well.
because the therapeutic relationship is about connection. It is a very intimate relationship. And, you know, being able to establish that with somebody it's a wonderful thing. It's something that a self-help book can never do. It's something that empirically validated therapies never have assessed. You know,
Right.
you know, the truth is most if you take the idea that therapy should be validated, it should be research based, that's fine, because I know that that does help, some people with some situations. But you also have to recognize that you are seeing yourself as a technician, really,
Mhm.
than you are as a healer. And I, you know, I don't lean in that direction.
I can guess that many therapists don't lean in that direction either. And thank you so much for coming back to the topic because I would love to get into my next question if that's okay with you.
Hmm. Sure. Yeah.
So, what I also found interesting was how this one researcher divided self help books into two axioms of categories: growth oriented and problem solving oriented books, and eclectic versus theory guided. Most self help books written by psychology professionals are written as problem solving and theory oriented, meaning on their title and written book, they'll address a specific psychological disorder and use evidence based practice to describe and help this particular issue. This sounds like within the scope of competency. This, however, still makes me feel uneasy because this gives me the impression and huge assumption that readers are given proper diagnosis and or if it's appropriate for readers to self-diagnose. What
Hmm.
ethical issues can this possess? If a clinicians are writing self-help books that frame up problems in terms of specific disorders and evidence-based treatments, are we unintentionally encouraging self-diagnosis without proper assessment? Are they extending clinical authority into a space without assessment, consent, and oversight? What are the clinical and ethical implications of this?
So I think that's a really important question, and there are multiple clinical and ethical implications of that. Um, One is, as psychology and psychotherapy become more and more incorporated into the fabric of everyday life, we see, our language that at one point was very specific become, used by the lay public in ways that are, incorrect and
Mhm.
and inaccurate. Today everybody's a narcissist,
Oh, yeah.
everybody's got trauma, everybody is toxic, everybody has ADHD, everybody is bipolar. As these terms get out there, people use them more and more casually. And
Mhm.
so that is a problem. I'm not sure that it's a problem that we can do much about as therapists, except to be, careful in the language that we use. But, people do sort of take the language in all healthcare disciplines and apply them in ways that they believe are correct, but often are not correct. So there's certainly a clinical implication there. But on probably a more important level is, you know, there's an issue about just how ethical is the diagnostic process to begin with. What I
Okay.
mean by that is, you know, the DSM, which is our, sort of diagnostic guide and diagnostic Bible, um, is a really interesting and thoughtful book. I know a lot of people who over the years have worked on different editions of the DSM. I know how much time and how much energy and how much thought goes into it. But the DSM itself has some inherent problems. One is that psychiatric diagnosis is based almost exclusively on patient self-report. We
Huh.
have We talk about diagnosis in psychiatry and psychology as if we have something that's truly scientific. But if you know the symptoms of some particular DSM disorder, you can walk into any therapist's office and say, "This is what I'm experiencing," and receive a diagnosis. You can't do that with strep throat,
Right. We don't
right?
have some kind of blood test to determine someone has generalized anxiety disorder or bipolar disorder.
That's right.
Someone can just come in and be like, "I've been overthinking, and because of this, I can't sleep."
Right. And then we try and diagnose them with something. The problem with that is not only are the diagnoses not backed by any objective data. You want to talk about evidence-based therapies. Here we have diagnoses that have no evidence behind them. I don't
Oh,
know. I don't know
okay.
how I don't know how you measure the therapy when you don't have any more objective markers for diagnosis. But that aside, let's say somebody comes in and we assign a diagnosis to them. Then what? Does that direct the treatment? If it does, then we've really sort of medicalized these problems of living to the point where we are now treating a label. We're treating a diagnosis. For example, if this is your diagnosis, this is how you should be treated. That's probably a good idea with something like strep throat. But, so you're a therapist. Granted, you're much younger, than I am. So you haven't been working as many years, but I'm sure you've treated a lot of people who were diagnosed with major depressive disorder.
Yeah.
How, how similar do they look?
Not a single one.
Their presentations are so different, right? So
Yeah.
different. And so the idea that someone who's diagnosed with major depressive disorder would be treated with this type of therapy completely dehumanizes the individual sitting in front of us. The person sitting in front of us, they may be complaining of symptoms that we would diagnose as major depressive disorder, but their depression is not like the next person's depression or the next person's depression. We need to target and tailor the therapy that we provide for that person to the needs and the personality of that person. So I have some serious questions about whether or not the diagnostic process that we use is ethical.
How do we come up And how does the folks, and let me also, for the listeners who don't know what DSM is, stands for Diagnostical Statistical Manual. It's what we clinicians use to diagnose. How do we come up with diagnosis? How do we determine what are the symptoms? How do we determine that it's a yes or no? This is what generalized anxiety disorder is. How did those in the committee come up with that standard in the first place?
Well, and I think that's a really good question too, that a lot of people don't really know the answer to. The answer is that, and again, I don't want to take anything away from the hard work and the dedication
Of course.
and the desire to produce something that is truly worthwhile from the people who work on the various DSM groups, and subcommittees. But the bottom line is what's in and what's out is going to be largely determined by the assessment and the sentiments of whoever is working on the DSM for that edition.
That worries me.
Well, look at the case, in terms of the sex therapy world, one of the most obvious is homosexuality.
Right.
Homosexuality was classified in the DSM as a disease. It was a psychiatric illness
Unfortunately.
until I think DSM-3. I may be wrong about that, but I think it's till
Yeah.
DSM-3. So the reason it was taken out of DSM-3 was not because we had discovered any new scientific data. It's because the sentiments of the culture had changed. People didn't think that people attracted and being sexually involved with members of the same gender were psychiatrically ill. We changed our mind about it. We reassessed, we changed our mind about it. Now, you can argue that it never should have been in there in the first place, and
Yeah.
I certainly wouldn't argue that point. But it's important to recognize it was removed because the vote of the people who were working on that section of the DSM for DSM-3 didn't think it belonged there.
And when we look at the DSM, a lot of the key phrases that they use is outside the norm. And for a long time, those who were considered queer were considered outside the norm because, quite frankly, we just didn't understand it. And we have to thank those who really, really stood up and vouched for the community to take it off the DSM. And this
Mhm.
also, that keeping that in mind, what's still in the DSM, if I'm not mistaken, it's in the DSM-5, is sadomasochism, a
Yes. Mhm.
paraphilia, as a paraphilia. And that is so concerning because of how much or how often we work with kinky folks and how often that they have these thoughts, these feelings, these fantasies of wanting to experience kink, to experience stimulus, to experience restraint, and concerned that their therapist is going to diagnose them as being ill because it's on the DSM.
Well, you're right. And the sexual disorders section is really the only section that I'm aware of that diagnoses based on behavior. In other words, let's say you um, have obsessive compulsive disorder, and you want one of the common presentations of that is excessive hand washing. I've worked with people who they wash their hands so much that their skin is so dry and
Mhm.
brittle and it's cracking and bleeding. I mean,
Yeah.
it's really, so painful, right? We don't diagnose them with a hand washing disorder, right? Even though the symptom is how they wash their hands. So if someone is interested in BDSM, why would we diagnose them based on what they do? I mean, washing your hands is a good idea. Excessive washing your hands can be problematic. BDSM is perfectly fine to people who are engaged in this,
Mhm.
and most other paraphilias are psychologically as healthy as anybody. But I suppose, there could be people who take it, you know, too far, let's just say, it's
Right.
but what drives that, right? Is it an obsessive compulsive factor that drives that?
Mhm.
It's usually diagnosis is based on what's driving something as opposed to the behavior in and of itself. The way the DSM has been written with the paraphilia section is basically anybody who participates in this kind of sexual behavior gets a psychiatric diagnosis. That would be like diagnosing anybody who washes their hands with a psychiatric diagnosis.
It's like if someone were to tell me something kinky, and for me, if it made me uncomfortable, I'm like, "Yeah, that's not normal. There has to be a reason behind it." But it's again going back into the behavior and let's say into um I think when you're talking about like internal mechanisms, I think of hypersexuality. Or before I became a sex therapist, I hear all the time the word thrown out hypersexuality or compulsive sexual behavior. And I'm with I agree with like, it's not a real diagnosis, but rather it's a symptom that can be an expression of so many other things. It can be an expression of OCD, it can be an expression of trauma, or quite frankly, maybe this person's having quant quantiful quantiful, I don't think that's a real English word, sexual experiences that are full of consenting adults, and the therapist that happened to listen to this thought that that was hypersexual. Or someone is exploring their sexuality as a young queer person. It can be all these things, but according to the person that's listening and just paying attention to the behavior, now we have hypersexuality.
Well, that's, that opens up another interesting, can of worms because most of the things in the DSM, in order for it to be diagnosable, it has to create distress,
Correct.
right? But oftentimes in sex therapy, it's not really clear whose distress are we treating. So, for example, a
Yeah.
lot of times, the diagnosis of hypersexuality or sexual addiction or sexual compulsion or whatever you want to call it is being made by the person's partner. Not by them, right? They're not
Yeah.
distressed. And the same thing with certain paraphilias, right? The person who is participating, is perfectly fine with that, but their partner thinks, "Oh my gosh, that's disgusting," or "That's sick," or "That's whatever,"
Mhm.
and so you must have a problem. And as you said, sometimes it's even the therapist who's saying, "Oh, yeah, that doesn't sound right to me. Yeah, that doesn't sound good to me." Even though the person sitting in front of you is not distressed. Now, it's even a little further complicated, though, because a lot of times
Oh,
people who do engage in behavior that is problematic are not distressed about it.
I've also seen
Like,
that, yeah.
right, like a lot of child molesters. They're not distressed that they are attracted to prepubescent children
Mhm.
or that they sexually engage with them. Um, so does that mean there's nothing there to treat because they're not distressed? You know, the DSM makes everything sound so neat and clean, and human behavior is messy. Therapy is messy, which is one reason why it's so difficult to measure outcomes or anything else about therapy.
That brings such an interesting point. It's just like, whose distress do we prioritize?
We see in sex therapy all the time, uh, partners who find out that their partner masturbates. And, a lot of people are perfectly fine with that. But there are also many people who say, no, sex is something that you should only be sharing with me. And I don't understand. If you have a willing partner, why would you want to do it yourself? So, what do you do with a couple like that? Is there some diagnosis there? Or is there a difference in values or a difference in opinions that need to be worked out with the couple, right? That's not, I mean, in my mind anyway, that's not necessarily something diagnosable.
No, it's completely contextual.
Yes. And people like, Thomas Zaz, for example, and other more humanistic, existentially oriented therapists. They are very much opposed to what is sometimes referred to as the medicalization of human life. And the idea that you can diagnose problems of human living the way you would, you know, strep throat
Mhm.
is to them nonsense. It's mechanistic, it's reductionistic, it's not helpful,
It's impersonal.
it's impersonal, and it's highly judgmental.
The day prior to recording this, I saw on social media, and it was this comedian who hired an AI therapist. And it was full of oohs and ahs, and in the comment section was therapists being like, "Oh, man, I have to now start changing my responses to when clients speak." A lot of therapists right now are concerned or worried about being replaced by AI. I'm really feeling like I don't think we ever will be because there's nothing like human connection. But also, AI is a machine. Looking at it that way, it's just like it's probably going through a list of symptoms. Yes or no, yes or no. What's the best way to treat this person? It goes by evidence base.
Mhm,
I don't think an AI could ever think like me, Figs, and be like, you know what? This actually might be a good time to bring up this. Or maybe, you know what? Let me lighten the mood or like bring humor into the session. I don't
mhm,
think it can ever replace how all of us are different and interact with our clients differently.
yes. Well, I agree,
Mhm.
and I certainly hope that we are correct. But, I remember back in the early days of my practice, talking with friends of mine who were urologists. And
Oh,
of course,
interesting.
most men with erectile dysfunction would go to their urologist. That's where they would go first. And then the urologist would refer to sex therapy, perhaps.
Mhm.
And we used to say, you know what? If they ever come out with a pill to fix this, we are out of business. And then in the late 90s, Viagra is here. And I will tell you that many urologists and many sex therapists thought, well, it's been a nice ride, but the end is here. And only one thing happened. We all got busier. What happened was the idea that there might be a simple solution made people more willing to get started in the process. So they would go see if there was help and they might try the Viagra. And for some, it was very helpful. But, for the vast majority, it really wasn't. People are surprised to find out that as popular as Viagra and, Cialis and Levitra, how popular those medications are, less than 50% are ever refilled, ever. So a lot of people are trying them, but very few, relatively speaking, are satisfied with the outcome. But once they've begun the process, now they're in the sort of healthcare system, they're much more likely to take the next step. And so I think that could happen with AI too. AI
Okay.
may make more people to begin the search for, is there a solution to my problem? They'll get a, kind of simple suggestion. They'll try it. It won't do what they are hoping it will do.
Right.
but they'll take the next step and call a therapist. So it's very possible that AI will do, for psychotherapy generally, what Viagra did for sex therapy is it just made the field explode where people were coming out of the woodwork thinking, okay, you know what? Maybe it would be a good idea for me to see if I can get some help for what bothers me, whereas they may have been reluctant to do so before.
I love that point of view. One of the things I was thinking about in regards to AI and also self-help books, trying my best to stay on topic because I love the direction we're going, is I worry about how folks will start by reading a book or start with AI and then experience and be discouraged by the experience. Discouraged that wasn't helpful, discouraged and feeling like they're unhelpful, no one will understand because books have an
Yes.
ability for universality. If someone wrote about it, then this must help a lot of people. But somehow this is not helping me. That's my biggest concern. But hearing you talk about Cialis,
Hmm.
Viagra, and what it did to our field, and
Yeah.
now how I mean, people talk about erectile dysfunction, at least around me, I think the conversations we experience in our personal life cannot be it's not close to the norm, but
Yeah.
at least around me, I hear about erectile dysfunction at least once a day.
Yes. That's right. Yeah. Yeah. No, you're right. We get used to hearing conversations that most people blush at. Yeah. Yeah. Yeah,
It's
we
a
do.
joy. It's fun.
You know,
Um,
it is.
but
But I hope it does take that path though, where, if a self-help book, and you're right, it could discourage some people, if they read the book and they do what the book says, and they didn't get better, they might be discouraged. But I think it's more likely that they would say, I'm going to try something else.
hmm,
I hope that's the case, and if that is the
yeah.
case, I think self-help books can provide, a really helpful entrance to the path. I don't think they provide the solutions to the issue, but there's an entrance.
You're a very optimistic person, and I'm just going to absorb some of that and try to incorporate. I I'm a very much a cynic when it comes to I help so many other people. I do. I love what I do. I love being a helper, but I can be so cynical. So
Yeah,
hearing this from you,
yeah.
it's very refreshing. So thank you.
Good.
And so we talked about how most books are written by mental health professionals, but we haven't really talked about the accent, which is eclectic and growth oriented self help books that make up
Yeah.
most of the self help books section and the top bestsellers. In other words,
Yes.
these are books that we pull from different school of thoughts and doesn't treat a specific problem to a much broader audience. If the majority of best selling help books are eclectic and designed to appeal to a broad audience rather than grounded in a specific evidence based framework, I'm starting to hate this word. Are we prioritizing marketability over psychological accuracy? And what ethical issues does that raise?
Well, it's an interesting question because I sort of land on the side of the books that are more targeted and empirically based, I think are less likely to be helpful than the books that are more generic and philosophy based.
Okay, that goes completely against what I said in the beginning of the episode. So please tell me more and tell me why. Prove
So
me
again,
wrong.
you know, even look, let's say, let's say you want to learn to play an instrument.
Okay.
And so you take a course that teaches you how to play the instrument.
Hmm.
Do you play an instrument? Are you
I
musical?
do actually play the guitar.
Do you?
I
Okay,
do,
good.
since I was 8.
Okay. I started playing the guitar when I was 8 as well.
Oh.
So have you had one teacher and just stuck with that teacher's uh, teachings since you were 8?
Oh, absolutely not. I couldn't finish a course for the life of me. I would just study songs and then jump from song to song.
But why? I mean, if here's somebody who is telling you this is exactly what you need to do to be a good guitar player, why don't you just why would you look elsewhere?
Well, that's a good question. I think at the time of my adolescence was I got bored. I got very bored. I hated the repetition and I just wanted to jump and I just wanted to play or whatever my mood wanted. But it was really hard for me. I think the longest I was able to stay with any kind of teacher was in high school, and
Mhm.
that's about it.
Okay. So the reason I bring that out is because becoming a good musician, I mean, we're guitar players, but, I
Mhm.
think it's probably the same for any instrument. You have to find your way. You have to find your style. You
Yeah.
have to find your sound. And so most people who are good musicians have gotten input on how to become a better musician from multiple sources, plus their own self exploration. That's how I look at those targeted self help books. You are listening
Mm.
to one voice, one idea, one interpretation. And while maybe that's going to do it for you, I think most people get better at whatever it is they're trying to get better at when they have input and when they're open to input from multiple sources.
Yes.
If you want to read a book that's helpful to you, in my opinion, read M. Scott Peck's The Road Less Traveled. Read Irvin Yalom's Love's Executioner.
Hmm.
Read books that inspire you to look inward and to trust yourself and to find your path and to be courageous and to take risks and to try new things. The book that says, first do this, then do that, then try this, take some deep breaths, it may be helpful, but we could be more ambitious than that. Let's say you have a fear of elevators.
Okay.
You have a type of claustrophobia. Uh,
Uh, many folks have struggled with that.
Yeah, yeah. Well, I think it's very possible for a self help book to get you to the point where you can ride in an elevator,
Wow.
but you will be miserable doing it.
Oh.
So it'll help. It can give you some tools or techniques to endure the ride, but it's not going to make you comfortable.
I think, quite frankly, if we're going to the realm of self-help books and I'm dealing with the discomfort or of claustrophobia and heights, I feel like elevators is like a dual diagnosis in that regard.
Hmm.
I will likely drop out of a book. I will probably stop reading once things get really uncomfortable because I
Yes.
I think that will be my challenge compared to a therapist or if I've worked with therapists who specialize in OCD and when they do those exposure treatments and their clients
Hmm.
are screaming or kicking and really, really resisting and they go forward anyways, that I think
Yeah.
it's so fascinating, those type of therapists, but a book can't do that.
No, no. And that's why I say, I mean, best case, the book may be helpful, but hopefully what the book does is inspire you to take the next step, which is, okay, these ideas are interesting, but I'm not able to do them. Maybe if I saw a therapist, I could take that next leap.
I'm hearing very pro self-help book in this conversation, and I don't hate it. It's just go
Mhm.
it went against my expectations, which I generally love. I love being proven wrong. I love I think that's the beauty of being a cynic is, like, I'm
Well,
critical of myself as well, so thank
yes,
you for
okay.
that.
Well, and I hear you, but, to be clear, all of the things that I have said today about self-help books are, what I believe, and I think I'm giving you the best case scenario. That said, I've never read a self-help book that I thought was worth a damn.
You just recommended books.
I thought that the book might help lead you someplace else. I've never read a book, self-help book, that I thought actually was likely to be very effective. The ones that I mentioned, yes, I do think, but I don't necessarily consider them self-help books, even though The Road Less Traveled, it's characterized as the best-selling self-help book of all time. But it's not a book that says this is what you should do. It's a book about trying to understand yourself better and to push yourself for growth. It doesn't tell you how to, you know, have better sex,
It tells you and how you need to be a bit more creative or encourages
more
creativity
creative,
with
more
sex.
responsible for creating your own life, um, more accountable, more risk taking, um, more courageous, you know. Yeah, it encourages you to do all of those things. It's not a step by step manual.
Do you give bibliotherapy? Do you ever recommend books to your clients in tangent or part of therapy? Do you ever give it as homework?
Rarely.
Rarely.
Yeah. There are some, you know, like the ones that I mentioned. I'm a big fan of The Road Less Traveled. I'm a big fan of Love's Executioner. I
I'm gonna
like
put that on my
Emotional
list.
Resilience by David Viscott. I like a lot of books like that. Um, but you know, if you're trying to overcome your fear of heights, I don't know of any book that I found that I thought was particularly helpful.
Well, you definitely made my reading list grow. I will also like to add, I bought your book. I'm started reading
Ah,
it.
thank you. Thank you. What do you
Absolutely.
think?
It's pretty good. It's making me think. And I was like, well, might as well since you're here. I'm like, okay, maybe buy more books. It gives me an excuse. And
Even my own book, I don't recommend. Although,
what?
sometimes I will, people say, is there something I can read? I'll tell them, that you might want to read my book to get an idea of how I think and how I work and what my approach is like. And you may see parts of yourself in the book, in the cases that I described that may resonate. And so, we can use that as a lead in. But I don't say, everybody that I see in therapy that you have to read my book.
it it almost feels like your book is like your consultation call.
I get a lot of people who call me because they read my book. They've heard me speak on a podcast, like this, or some other presentation. It's a book I'm very proud of. I mean, I like it. I'm pleased, with the product. It was the book I wanted to write. It does really talk about problems the way I conceptualize of them. It's written primarily for a professional audience, but in a way that is accessible to non-professionals as well. I tried to keep the jargon to a minimum, use lots of cultural examples like, scenes from movies and, excerpts from novels and that sort to illustrate certain points. So yeah, I hope people read it. It has sold rather well. I'm pleased to say that.
Congratulations.
Thank you. But yeah, it's still, I don't think reading that book is going to solve anybody's problems. but it brings them to me, so that I can help take them to the next step. And I think that's a good thing.
I'm gonna go a little off topic because what you said just now was it's very different than, I guess, like, one of my personal takes as a Latina therapist. So, a lot of my clients I work with are in my community, and we talk a lot about collectivism and how psychotherapy and this is also my feelings about self-help books. It focuses so much on self-actualization, but I also feel like self-actualization can be a form of hyper independence and it can be very individualistic. That just doesn't resonate with a lot of folks.
Hmm.
And a lot of my interventions and when I working with my clients, it's more so like how do we work with our community with the resources that we have? You know, we talk so much and going back into pop psychology jargon that now everybody's using about cutting people off and toxic relationships is like, well, for a lot of Latino folks, that's not really an option. It can't be an option because not just because I feel morally obligated, but it's not within my culture, it's not within my values. So
Yes.
that's one of my critiques, my personal critiques about self-help books. It's just like I think it makes everything so individualized. And maybe that's also like the part in which, you know, looking into like what are exactly are the interventions that these books are recommending. And your take on rather it about being about exploration, introspection, courage, I think I really like that because it goes back into, like, actually maybe eclectic self-help books are a lot more helpful because it gives
Yes.
power to the person to adjust the thoughts, the feelings into their culture, their belief systems, and their values.
I think you're right. That's one of the limitations of self-help books, generally is that they are not very culturally sensitive. They don't take into account a wide variety of cultural, traditions and values. And have to tell you, and again, not knowing, a lot about, the Latino community,
No worries.
but but I think, the trend in therapy these days that parents are toxic and need to be cut off is a real mistake.
Ooh, let's hear this
Um,
take.
I mean, I'm not saying that there aren't some parents who are truly
Yeah.
toxic. There are, of course, there are. There are
Mhm.
people who are abusive. There are people who are heavily involved in substance abuse. There are people who, for a variety of issues, probably never should have been parents, and they have not treated their children well. But a lot of times, these are parents who have done the best that they could. And really, their hearts were in the right places. And they want to be able to have good relationships with their adult children. But these days, the tendency is to cut people off, not to work it out. It's not my job to help you understand me better. Well, yeah, it kinda is. That kinda is all of our jobs, and, these days, it fits into the whole, zeitgeist of society where people are so divided and so separated and so quick to cut people out for, one thing that they don't like, what's coming to my mind today is, political choices. If you support
Mhm.
this person, I can't have anything to do with you. People are more complicated than that. They're not single issue people. And people, because they have a different opinion than yours, doesn't make them toxic. It doesn't make them, people that you need to cut out of your life. And I've seen a lot of families be destroyed for issues that are not what we would have considered abuse issues. at one time, and I'm not convinced they're abuse issues today.
Mhm.
You know, do you need to sometimes, keep some people at arm's length? Yeah, yeah, you do. You do.
Right, boundaries.
Boundaries are important, but boundaries can also be flexible. They're not all or nothing. And that seems to be the way a lot of people and a lot of therapists are looking at that issue these days. It's all or nothing. Cut them off, get rid of them, as opposed to maybe we can work it out and maybe we should try that first.
I tend to look at boundaries as bridges. It's a way in which we communicate or the agreements we reach so that we can both cross this river, cross this divide, and where we're both comfortable. I think people, and like this is again where a lot of people are using pop psychology or therapeutic terms without truly understanding them or why they exist.
Yes.
And I hear often, and this is just like all the time on social media. I'm a zillennial. I'm between Gen Z and millennial, very young millennial. So
Hmm.
I hear all the time, protect your peace, protect your peace. And I'm like,
Right.
yes, I love my peace. But also when you remove so much noise, it's not peace, it's just quiet.
Well, you're right. And you know what? So it reminds me. So back in the day when I was training, what was really popular back then was assertiveness training groups.
Interesting. Never
Yeah.
heard of these.
Well, we're talking the 70s. But assertiveness training, being able to, stand up for yourself in a forceful but not aggressive way, but in a strong way, to take your position, to hold your position.
Hmm.
And on the surface, that sounds like a really good idea.
Right. You're standing up for what you believe in.
Yeah. But what people also had to recognize was that if you follow all of the tenets of assertiveness training, nobody's going to like you very much.
Really? What are these tenants?
Well, because it's too inflexible. It's too strong.
It's
It's too
rigid.
judgmental. And so when you say something like protect my peace, to me, that's a great way to end up dying alone because people are complicated and relationships are complicated. And sometimes they get messy and nobody is going to be 100% of what you want them to be. But that's also what makes life so interesting. That's how you learn. That's how you grow. Peace uh, gets you no place. I mean, it's nice to have peaceful moments. I'm not saying that it's not. That's great. And certainly you want to be with people who are respectful, you know,
Mhm.
but that people kind of shake you up a little bit and get you to think and reconsider. That's the beauty of being human. Protecting my peace to me just sounds like, don't don't ever, bring anything into my life that's going to disrupt my serenity. Well,
That
okay.
sounds about right. That's a lot of what I hear.
Yeah, well,
And
where's that going to take you? Where are you going to go with that?
my dad, one of the things that he would say to me all the time growing up was, "If everyone thinks like you, everyone looks like you, and is like you, we have a problem." And I was always encouraged to engage, have friends, and be part of different communities, and I think that just shapes who I am. I think it gave me a wide breadth of experiences and meet amazing people who I call my chosen family. And it does require some distress tolerance. It does require being uncomfy. So going into your point is just like, yes, we can have friendships, we can have relationships with disagreements, but it's not just our rigidity we have to look at. We also have to look at that person's rigidity because
Sure.
I can imagine it would be really hard and really difficult to maintain a conversation with someone who's not willing to listen and then
Absolutely.
also try to understand your point of view either.
Absolutely. I agree with you. But I think just, what I would hope is that people would find differences fascinating as opposed to threatening. I'll give you an example. Um, I'm not sure if this is true or not, but this is what I was told. So,
We can fact check after.
okay, well, yeah. So, or you could tell me because you're Colombian. Yeah,
I am.
yeah. So, several years ago, I heard about this new restaurant,
Okay.
a Colombian restaurant owned by people from Colombia, Colombian food. They said it was very good, very
Wonderful.
authentic.
Nice.
And so I said, yeah, let's go. Let's check it out. So we went, and the people could not have been nicer. I mean, the service in the restaurant was really, really good. And the food was terrific,
Love to hear that.
terrific. But after we're finished, we're sitting there and sitting there and sitting there.
uh,
And I think we were sitting there after we finished eating for at least as long as we were sitting there when we were eating.
yeah.
And I couldn't figure out why they didn't bring the check. And someone told me that culturally, that would be considered rude. You don't bring a check until someone asks for it.
Yes.
That's true. Yeah.
100% true.
Well, I didn't know that. I didn't know that. None of us knew that. And so we sat there forever
Yeah.
because,
All
you know,
day, all night if you have to.
right, because, they said the value, the value of the Colombian culture is, no, sit, talk as long as you want. That's, you
Conversation.
know, conversation, wow, and it would be rude to make people feel like they weren't welcome and they should leave. So you
Yeah.
get a check when you ask for a check. Well, I didn't know that. None of us knew that, but I thought that was fascinating. Now I know other people who would say, well, come on. This is America and we do it differently over here. And you want to do business here, you need to know how we do business. It was a cultural learning that I thought was just fascinating.
I it's funny because I now experience the switch. So I just had my 2-year anniversary of living here in Colombia, and I visited the United States a couple months back, and I experienced culture shock or reverse culture shock. And it was really funny. I went out to dinner with a couple friends, and I was that friend that had their hand up constantly. I'm like, "Can we get water? Can we get check?" And I'm like, "Hey, they didn't bring you your sauce." And they're like, "No. Where's the sauce?" Like screaming it out loud because
Mhm.
I just forgot that that is very un-American, that no service staff are supposed to rotatedly, like, check up on you. You
Right. Right. They said in the Colombian restaurant, that's just considered rude to interrupt people. When they ask for something, you bring it. If they don't ask, you stay away.
Yeah. Yeah, we have a saying, and it's in Spanish, is that the baby that doesn't cry is the baby that doesn't get fed.
Right.
Oh, that's so funny that you experienced that in a Colombian restaurant. Yeah.
Yeah. But to me, that goes against the, don't interfere with my peace.
My goodness. I'm about to open a can of worms. So I live abroad and I travel abroad, and I just came from Europe. And I one of the things that we talked a lot about American ignorance, because unfortunately, a lot of Americans do not have a passport, do not travel abroad, and so do not have many cultural experiences. And so when they do travel outside, they expect others to adjust to them.
Yes.
And they fuss, they get frustrated, and I think that's a little bit again of like protecting my peace. It's just like I expect others to accommodate to me and my comfort level. And I don't take a breath or a moment to understand others or why people do the things that they do, behave the way they do, speak the way they do, eat the way they do.
Yes.
And you really miss out on life protecting your peace.
Yeah. And look, I think referring to it as American ignorance is rather generous. I think of it as American arrogance,
Oh,
where Americans think that they shouldn't have to, you know, learn another language, or if they travel to another country, they shouldn't have the grace to try and speak the language that, the people whose country they are visiting. And we're a little spoiled because most countries, people do learn English. But,
right. Lingua
one of the things
franca.
that I have always, yeah, one of the things I've always thought was a real gap in the education of Americans is we don't learn another language. Whereas people in most other countries, they do. They learn English, but I mean, I know so many people who have come over from Europe and South America. They speak 5 languages.
Yeah. Everybody in my family speaks three.
Well,
And when I'm struggling with my third and I'm actually learning my fourth, my family's reaction is like, American, just taking your time. You're taking too long. And I'm like, I feel like I'm pressured to keep up with them. And when I go back to the States, I'm like, yeah, I speak three. Whoa, what do you mean? It's like this whole thing. It's the attitude's completely different.
well, and so to kind of bring that back to where we started, another thing to remember is, you know, for Americans and American therapists, we talk about ethics as if our ethical positions are universal, and they are not.
It's kind of like one of the things I've been learning on my self research, but just reading articles for fun is just how there are even diagnoses that exist in the East that don't exist in the West,
Mhm.
and treatments that exist in the East. And there's so a breadth of information, and we completely devalue it because it's not Western. The episode,
Yes.
if you ever listen to this podcast, I talk a lot about horror video games and interest in horror because I was talking about Ghostface Kink. And most of the studies I pull from are from the East and Nordic countries. I would have not come across these studies if I just didn't have a genuine interest. It's a bit of a academic arrogance, maybe.
Absolutely.
I appreciate it. You're very energetic. I would not. I think bleh, when I hear age, I'm like, I don't want to hear you call yourself old unless you're calling yourself wise. Otherwise, I don't think so. Um.
I'm okay with old.
Okay.
I I consider myself lucky. I mean, what's the alternative?
I don't know. What's the alternative?
I guess I would have been dead by now,
Oh, okay.
right?
I thought it was gonna be a lighter place.
Yeah. So
Okay.
to me, old, that's kind of what's supposed to happen. And if you're lucky enough, that's what does happen.
Yes.
So to me, old is fine.
It's a blessing.
It
It's a
truly
blessing.
is. It
Well,
was.
thank you so much, Dr. Water. I really
You're
enjoyed this
welcome.
conversation.
Me too. Me
Um,
too.
is there any last thoughts or things that you want to share to our listeners about yourself or about what we talked about, or rather future recommendations about the topic of self-help books? I know we went super off tangent,
Mhm.
but to bring it back, any
Yeah.
last
Yeah. I mean,
thoughts?
yeah, we did go, on a few tangents, but I think it all comes back, to the same basic core, which is that, human existence is is messy, it's nuanced, it's complicated, and anything that promises you the answer that kind of travels a straight line should probably not be trusted.
Thank you so much, Dr. Water.
It's my pleasure. Thank you. Thanks for having me.